everybody for attending today and for the OEH seminar for inviting me to present. I'm just going to share my screen, and if Angela, you can let me know that you can see that. Okay. Can you see the slides?
Yes, I can. That's
Okay,
great.
perfect. Okay, so today's talk is really looking at climate change and opportunistic pathogens in the built environment. And some of the work we're doing at the NCCEH right now is trying to understand how climate change is going to be impacting on some of the key areas of environmental public health practice. And so this one area of interest is relevant to my portfolio of work and understanding how the interactions of populations with water and waterborne pathogens, particularly in urban centers, might be changing with a changing climate. So I think this quick poll might not be as necessary because we're seeing lots of people putting their names and their current roles in the chat already. But if you want to put your answers to the poll in there, and we can get an idea of who's watching today. And the results will pop up in a moment. We've got lots of students, OEH professionals, researchers, and others joining. Got some water engineers and professionals, EHOs, epidemiologists, policy analysts, and then other. I hope there's going to be something in this for everybody today. So that's good for me to know just going forward. Okay, so I don't know if that poll has stopped. So the work that I'm going to be looking at today, we over the past year looked in detail at this document that was put out by Health Canada in 2022 on health of Canadians in a changing climate, and looking for areas of EPH practice that might be impacted here. And one that stood out for my portfolio of work was the increase in infectious diseases acquired by inhalation from environmental sources. And in the document, it specifically mentions risks associated with exposure to Legionella in the context of positive correlations that have been noted between legionellosis and temperature and precipitation, the potential for storms to be affecting transmission of bacteria and airborne particles, and possible changes in exposure due to changing demands for cooling and other ways that we might be interacting with water in the coming years. So what I'll cover today is how we sort of synthesize some of the review that we did on this topic, which was published in Environmental Health Review in October. So feel free to go back and have a look at that document. So today we'll go over the who and the what of selected opportunistic pathogens. What are these and what do they do? And trends in some of the infections of these. So the what we know so far. Then looking at how and why climate change might impact sort of patterns of growth or patterns of exposure. And the so what do we do about these risks if we do see that things are changing? So for a quick overview of opportunistic pathogens, which some of you will probably not need. Sometimes we refer to these organisms as opportunistic premise plumbing pathogens, drinking water associated pathogens and associated with infection. There's a bunch of acronyms, but for simplicity today, we'll just call them the OPs. And these are pathogenic microorganisms. They're naturally found in aquatic and soil environments. And particularly, they can thrive in engineered water systems like drinking water distribution systems, premise plumbing, cooling towers, and treated recreational waters like pools and hot tubs and other types of recreational waters. And importantly, they're opportunistic because they cause opportunistic infections in susceptible individuals. So healthy individuals are less affected by these organisms. And a key difference with them is that something like an enteric pathogen that is treated at a water treatment plant doesn't tend to reemerge in a drinking water system, whereas the opposite is true for these. They can increase post-treatment within distribution and on-site water systems. So we chose just to focus on three, Legionella, Mycobacterium species, and Pseudomonas. And the reason why we chose these three is that they are responsible for most waterborne outbreaks associated with pathogens in drinking water, potable water. There's also some indication that they're on the increase and they are associated with a high level of cost in treating both the water systems as well as the infections coming from these. So some common characteristics is there's a general preference for warm water. They tend to colonize engineered water systems and premise plumbing. There can be some resistance to extremes of temperature and disinfection. So they have the ability to either form or join biofilms inside of pipes or fixtures, or be transported in free-living amoeba. They're mostly transmitted by inhalation of aerosols, although there's some differences in some of the groups. And we have that elevated risk for some groups amongst the population. So I'll go through each of these a little bit more, just so we get a better understanding. Legionella species, when we're looking at this, there's a number of actual Legionella species, but it's usually Legionella pneumophila that we're looking at in premise plumbing. And inhalation is the primary route of transmission. It's important to note that most cases of legionellosis are sporadic, but when there's outbreak associated, most of those outbreaks are linked to cooling towers. But we also see exposures from hot tubs, fountains, and other sources. The outcome of infection is legionellosis, which is a reportable disease in Canada. And that is comprised of Legionnaire's disease, which is a severe, potentially fatal pneumonia, and a less severe and milder flu-like illness called Pontiac fever. The elevated risk for legionellosis is amongst smokers, over 50s, men, and people with immune compromised conditions, as well as some socioeconomic groups and outside workers who might be exposed more. So quick poll number 2, what do you think? Are reported cases of legionellosis in Canada increasing, decreasing, or remaining stable? And we'll have a look at what you think. So far, nobody thinks that cases are going down. Okay, about 2/3, 70% answered the question now. Okay, so most people are of the mind that cases are increasing, or maybe they're remaining stable. So that's probably not too far off what is accurate. So we'll have a little look at that. So in Canada, the rate of cases is generally on an increasing trajectory. In 2020, we see a little bit of a drop there, and this data set excludes Manitoba, so there's probably some more data points to be entered into there, but generally we're seeing an increasing trend. There's been a COVID effect of legionellosis cases, which is related to probably less exposure out in the world, as well as less reporting or co-infections with COVID that didn't get picked up. And so there's going to be a bit of a strange look of the data in the next couple of years, probably. The only reported data up to now is 2020, which just picked up the that COVID effect for 2020. But if we're looking at elsewhere, we're also seeing an increase in the US, which is showed on the left, and they've only reported up to 2019, a small drop in 2019, which is probably because 24 states have not submitted data yet, so that's not a full data set yet. And that's also attributed to a COVID effect, so to speak. But if we look across the EU, we have a bit of a slightly different picture, and this may be because these numbers are averaged across 28 countries, so places that have higher levels of surveillance and reporting, or increasing levels of surveillance and reporting, are averaged out by those that maybe are not picking up increasing rates as well. But even so, we're still seeing a bit of an increasing trajectory with a bit of a dip towards 2020. So it's also important to note that these trends may be different for some groups, and some work that was done by the US CDC, there's a couple of papers on looking at how different socioeconomic groups are impacted, and there's a rising incidence amongst certain socioeconomic groups based on racial disparities, geographic focus, and seasonality. And some of the reasons for this are not perfectly understood. Could be that there are more susceptibilities to illness and health inequities amongst these groups. Could be neighborhood and socioeconomic factors associated with housing and types of plumbing. And there's also maybe a different risk of exposure if you have different groups that maybe comprise more outside workers or people that could be exposed in occupational settings as well. Moving on to Mycobacterium, and here we're looking at, it's a big group of Mycobacteria species that causes everything from leprosy to tuberculosis. But when we're talking about potable water, we're pretty much talking about non-tuberculous Mycobacteria, and that is about 100 different species. Main routes of transmission are also inhalation, but also direct contact. So sporadic cases are most often associated with premise plumbing. When we see outbreaks, those are more likely associated with recreational waters. But we also see cases coming through from any kind of invasive procedures like medical or cosmetic procedures. There are a wide spectrum of NTM-related diseases and infections, from soft tissue to wound infections, pulmonary diseases. And it's important to note that these are non-reportable, so we don't have a good data set of cases coming through to see what the trends are. The elevated risk is amongst people with immune-compromised systems, cystic fibrosis patients, specifically for those pulmonary infections, and elderly females. The trends, as I say, are a little bit more difficult to pick out. And when we look at this review from 2022, that was looking at global trends across a large number of studies. Most of the studies reported an increase in NTM infections and disease, and that was in the magnitude of about 4% per year. And that's averaged across a range of global studies. Again, this trend is not the same for all groups. Although this is slightly older data from the US, we see that the rate of increase is higher amongst elderly people. There could be a couple of reasons why. We could have people living longer term use of antibiotics, better diagnosis and awareness, or there could be environmental factors that certain people are exposed to differently for different groups. But we have to recognize that not everybody is going to be affected in the same way. Finally, when we're looking at Pseudomonas, we have a range of transmission routes, which include inhalation, direct contact, and some indirect as well. Most dermatitis outbreaks that we see are related to recreational waters. And when it's a pulmonary infection, those are usually healthcare acquired. It's a range of infections, again, from eye, skin, ear infections and conditions, wound infections, urinary tract infections, and probably most concerning is the respiratory infections and the healthcare acquired pneumonia. And amongst cystic fibrosis patients, Pseudomonas is the major cause of morbidity and mortality amongst that group affected by healthcare related infections. It's important to note, again, this is a non-reportable illness, so we don't have perfect data on trends, but it's a priority 1 pathogen for AMR risk, so antimicrobial resistance and the need for new antibiotics. This is a priority 1 for more R&D into this area. The trends for Pseudomonas are confusing, to say the least. It looks like there could be a decrease amongst cystic fibrosis patients and those healthcare acquired infections in earlier data. However, we see some incidents of bloodstream infections, like including UTIs in England, increasing over recent years. And then the COVID effect. We see some co-infections, and that could be because more people were in hospital for respiratory type of infections, and they might have also acquired a Pseudomonas infection at the time. The bottom paper there was looking at sort of the impact of climate change on antimicrobial resistance amongst Pseudomonas species. And this paper considered that perhaps the prevalence of resistance is going to increase, especially in some Northwest countries of Europe that was looked at in this study, which could experience stronger climate change. But the mechanisms for that are not quite explained. We do see seasonality of Pseudomonas infections occurring when it's outside of the healthcare environment, some higher incidence in summer and autumn, but again, it's not quite clear if this is temperature or humidity related Or is it because people are accessing more recreational waters during summer and autumn time? But it's interesting to keep an eye on these trends and see what's happening. So for more on some of the waterborne pathogens, there was a good report published in September that has these and some of the other opportunistic pathogens in there. So I won't go into more detail about it. So when we're looking at considering how climate change might be affecting these organisms, the approach that we took was looking at how their presence in the environment, their growth in distribution and engineered water systems was changing, as well as whether there were opportunities for aerosolization to create those inhalation risks, and whether that inhalation exposure is going to be leading to infections. And in considering how climate change is going to impact these groups, we looked at increasing ambient temperature and precipitation and storm events as sort of those environmental conditions that could be changing. But we also looked at those human and built environment factors that could be changing, such as changing demand for cooling and changing patterns of water consumption. So I'm going to just go through some of this to understand maybe how these factors could be impacting growth, survival, and human exposures to OPs. So starting with the ambient temperature question, the literature generally tells us that warming will enhance survival and propagation of OPs in the environment and in premise plumbing. There could be changing seasonal patterns, and some studies have already started to show us that there's a shift in the seasonal peaks of Legionellosis cases that are starting earlier in the season, and they may last longer. So we may be seeing infections for a longer period of time. The key concerns with this is that, okay, there's that enhanced growth in the environment. This makes it increasingly difficult to treat our water, but it's also within the built environment, we have warming water coming in, we have warming buildings, pipe systems. It becomes harder to maintain low temperatures, which are needed to maybe prevent growth. So below 20 degrees, it becomes harder to keep things cool. So this can be in the distribution or in premise plumbing of buildings themselves. As water warms, we also see a decay in disinfectant residual that increases. So it becomes harder to maintain our disinfectant residual in water systems with warming. But it's not just warming. It's the literature does tell us that it's hot and humid areas too that we're seeing increased rates. So when you have hot and dry areas, the rate of Legionellosis tends to be a little bit lower. And this kind of rings true when we look at places like the US, where is the highest rates of reported Legionellosis. And we see the Northeast, and that's probably similar in Canada. We see it in like Ontario and New Brunswick and sort of the East Coast, where we have hotter, more humid summers. So it's that combination of heat plus humidity that might be more important. So if we were looking across some parts of Canada where we are seeing heat alone, if it's dry areas, that might not be the full story in terms of it's automatically going to result in an increase of infections in those areas. When we look at precipitation and storm events, heavy precipitation is associated with Legionellosis cases. It's harder to see an association with NTM infections, although there's some suggestion in the literature that there is, although the incubation time for these organisms is longer, so it's harder to connect those rainfall and precipitation events with occurrence of infection. We do know, though, that heavy precipitation and storms could and floods could result in contamination of stormwater, or source waters with storm flow. That makes it harder to treat and can enhance conditions for growth of some of these organisms by providing the organic carbon and nutrients that they can thrive on. We also see an increased generation of aerosols during storms and precipitation events, which could increase points of exposure. Storm events and wind are also important because we see wind-blown debris can contaminate cooling towers, which can deplete your disinfection residuals and increase growth. And we see in hurricane-affected states that there are increased levels of contamination in cooling towers and higher rates of infection. Storms and wind can also increase dispersion of bioaerosols, and we're seeing some cases in France and the Netherlands where wastewater treatment plants have been pinpointed as actually the source of Legionella infections quite a long distance away. Floodwaters and mud can also be sources of exposure, and we've seen cases where people involved in flood cleanup have been infected. So the key concerns are that enhanced growth in the environment, increasing treatment challenges for our source water, and the potential for increased aerosolization of some of these organisms. Some people may be more at risk, and that could be people that are outside, people who do a lot of driving, pedestrians in urban centers, and people involved in flood cleanup. Moving on to some of those human behavior and built environment issues, cooling towers are probably one of the most known sources of Legionellosis outbreaks. And as we move towards a need for more cooling in our warming cities, especially over some of the hot summers we've experienced recently, and in some places actually mandating now for a minimum level of cooling, or considering that as part of new building codes, we are likely going to see an increase in the number and duration or frequency of use of cooling systems. And coupled with that increase in favorable conditions for colonization, this increased cooling demand could see some increased risk. We're also looking at new ways to cool. And so that could be new or increased sources of aerosol exposure for cooling. And probably over the past summer, you saw some of the cooling stations had misters set up. Some restaurants have them, as well as places to cool. Increased use of splash parks and pools during some of these hot summer events as well, to try and keep people cool. And it's an important thing. Heat is a dangerous thing and can cause a lot of illness and unwell people in our cities during these heat events. So we do need sources of cooling. We just need to be aware that they could also be points of aerosol exposure. Increased use of green infrastructure as well to cool some of our buildings and greening some of our urban centers could also be a place where we see water being used in a new way. And some irrigation systems may use aerosolized water. If it's a drip feed, you have less generation or potential for aerosol generation. But sort of the bottom right picture there, looking at aerosolized misting to keep those green walls growing, could be a point of exposure. There was a study done in Australia of opportunistic pathogens in water mist systems used as a cooling intervention. And this was from 2021. And a test of the biofilms that formed inside the systems, the bioaerosols that were released in the water that was coming through, about 71% of them were positive for an opportunistic pathogen. Pseudomonas was detected in about 44% of all the samples, and more frequently in the bioaerosols than the water and biofilm. And Legionella was detected in about a quarter of the samples, and more frequently in the water than in the biofilm. Good to note that there was no NTM detected in this study, but it does show that these mist systems could be a point of colonization for opportunistic pathogens going forward. When we're looking at water consumption, we also have a driver to reduce how much water we're using. And when we're looking at energy efficiency, we can't really ignore water. In Ontario, for example, municipal drinking water treatment and pumping accounts for a fifth of municipal energy use. So if we're looking at our climate change impacts in total, we can't really ignore the fact that there is a high energy cost to clean potable water. So some of the ways that we're doing that are looking at water efficient devices, automatic or low flow devices, as well as water reuse in terms of gray water harvesting or rainwater harvesting. But how does this affect the growth or exposures to opportunistic pathogens? When we look at water efficiency, when we've got a system that's built to supply a certain amount of water, demand as demand goes, that can lead to an increase in water age. And water age is the amount of time that water spends inside a system from point of entry, for example, for a building to point of use at the tap. And the longer time it spends there, the greater reduction in disinfectant residual occurs, and there's also potential for enhanced growth of pathogens during that time. So that can be something that is needing consideration is water age. Electronic faucets can also be a point of colonization for things like Pseudomonas because of the fact there's low flow through those devices, and there's often poor temperature control. So you're not usually getting up to a hot temperature at some of these devices, and they have been the source of exposure in healthcare settings for infection, and in some healthcare settings, these automatic taps and electronic faucets are not permitted anymore. So it's important to be aware of where we're placing these and if there is a risk of colonization. For harvesting rainwater, gray water, there's plenty of studies that look at the quality of the water in these systems, and it can depend on where it's collected from, whether it's a collection surface and there's a picking up of debris or ash following a fire. And these can be nice little incubators for all kinds of microorganisms. The main concern is when you're reusing that water for something that generates aerosols and you can introduce a new source of exposure. So you need to be thinking about how we're reusing that water. And I came across this interesting example of a new way to be using water. This was from a UK National Health Service department in Birmingham, and they've installed a green wall inside the Children's Hospital, and they also have a Legionella tap flushing program within the building to flush taps to reduce Legionella risk. And they're proposing to use that flush water rather than putting it down the drain to water the plants in the green wall inside the building. So, okay, that's a nice sustainability use. You're not wasting the water, but there's also probably some thinking to go into the fact that you might be reusing water that's contaminated if it had been flushed. So if that water is being aerosolized to water those plants, I think that that might be an interesting area to look at the risk there, bringing it into a children's hospital. So going back to what we were looking at here in terms of how climate change is impacting each of these aspects of where opportunistic pathogens may be in the environment, distribution systems, whether we're seeing opportunities for aerosolization. How can we sum this up? Overall, we're seeing there's possibly an increase in contamination of source water, cooling towers, or other raw water sources, and there's enhanced conditions for growth, which could make treatment more difficult. There's a potential for increased colonization of some water systems due to temperature or changing patterns of use, making it harder to maintain opportunistic pathogen-free systems without any kind of intervention. And we're seeing some increased possible exposures to aerosolized water in the built environment. So outside during warm and humid conditions, storms, precipitation events, potentially because of more cooling demands and increased use of cooling towers, or new and increasing exposures to other sources of aerosolized water. So that's all nice, great. Is it a problem? Are our existing controls sufficient to deal with these changes? And we have a number of controls already in place. Legionellosis risk management for building water systems is an ASHRAE document that's been out and is well used. There's other types of support documents all over the place. And we look at things like limiting nutrients into our source water, disinfection, temperature controls, flushing controls. What might we need to adapt going forward to make sure that any changes in risk are being accounted for in what we do going forward? So quick poll, final quick poll. What do you think is the most important thing for managing risks posed by OPs in a changing climate? And there's quite a few choices here, but just want you to pick one. I know I could ask you to pick multiple choices, but what do you think is most important in terms of managing risks or reducing potential exposures? I'm very interested to know what you think. So we've got a range of answers coming in. I'm not surprised. And so far, we're seeing a mixture of opinions here. Only had about 58% of people have replied. So if anybody else wants to get your final opinion in there, I know it's a bit of reading all of those choices. Seeing quite a few. Okay, I would say it's a mixture there between upstream and downstream controls. The winner is really upstream controls and distribution systems, and downstream building water management. A little bit less in terms of source water protection and point of use treatments. Some people looking at the building users, public users, and awareness and better access to data. So great. It may be no surprise that we probably would say we need a combination of approaches. And so we'll just go through some of those. So managing risks in source water, we have to consider the changing quality due to seasonal changes, floods, precipitation. And when we're protecting source water, we want to maintain treatability by looking at turbidity, total organic carbon, those things that could reduce our disinfectant residuals in the system, as well as provide a nice, happy habitat and lots of food for these organisms to grow in. So we may need to be a bit more agile in how we adapt treatment to events or seasonal changes, things like flood and precipitation, and knowing our source water. In our distribution systems, there could be things we need to think about in terms of warming surfaces and warming pipes, where we're not keeping those cool temperatures as cool anymore, and what we might be able to do to prevent or reduce growth and maintain our disinfectant residuals. But we do have that trade-off of balancing adequate disinfection with risks of things like disinfection byproducts. And that's where it's important to reduce those upstream inputs of total organic carbon, for example, chlorine plus total organic carbon, you're going to get your disinfection byproducts. So that upstream upstream treatment of source water is important for your distribution system as well. And we also maybe need to think about how hydraulic changes might be occurring during the drought or water scarcity events as well. We have different types of quantities of water perhaps flowing through pipes during certain times. Some of those in-pipe factors are very complex, and there's a lot more that could be looked at in terms of this research. I won't cover it. There's a couple links there which you can look at, but it is very complex, but there could be some solutions to think about going forward. Downstream at point of use or point of entry, during certain times, do we need to consider point of use or point of entry treatments? We know that UV disinfection can be quite impactful. Membrane filtration at less than 22 microns can also be useful. And maybe system flushing or heat shocks. These are things already in use, but maybe we look at the timing and how often they have to be looked at. Also looking at water management plans, and these where they exist, are they still adequate based on today's conditions? Are there areas of changing risks? Do they need to be revised, or do you need to have a seasonal or event-based water management plan to respond to certain changes? Temperature management is less possible maybe to keep things at under 20 degrees. So what else can you do in terms of keeping those fixtures clean and maintained, and also looking at things like tools like cooling water registries, which I'll point to in a second, but these can be used to inform good water management practices as well as to facilitate outbreak investigations. So where to start? Maybe we are looking at the most at-risk buildings, neighborhoods, regions, and the most at-risk persons. So where is the source water impacted? Where might we see geographies or buildings that are going to be impacted more by warming or different things? Where don't we have water management plans? And in terms of those susceptible populations, do we have a higher concentration of elderly or immunocompromised people, different socioeconomic groups, different types of occupations? And where are we using water differently? And where's there demand maybe for alternative cooling, where we don't have, say, buildings with indoor air conditioning that they have to seek outside sources of cooling? And we know there's a lot of challenges here. There's those trade-offs in balancing public safety for disinfection byproducts, the need for cooling with sustainability, water and energy conservation. And there's a lot of actors along this chain, from source water protection all the way down to point of use. And that point of use area is quite complex. You've got the premise plumbing, cooling towers, recreational waters, healthcare settings, and then all of these new places that are using things like misters for additional cooling at certain times of year. So coordinated approaches may be needed, and that may include some awareness raising of those conditions that are changing risk. And that's sort of where we kind of are trying to fill some of the gaps, some partnerships with key actors along that chain, and having a better idea of how we might be able to adapt some of our existing controls to changing conditions. And things like cooling tower registries or other types of registries might be able to help in terms of knowing where those points of risk or concern could be. And also updating water management plans or implementing them where they don't exist. So just to finish off, I just wanted to show you, and I don't know, I think we probably have some folks from City of Vancouver on, but City of Vancouver now has a registry for cooling towers and other types of water systems like decorative water features, rainwater harvesting systems. And this is a really good tool for understanding where points of exposure could be cited. And this is a great open data portal that's available now. And you can actually go into this and you can see data from recent monitoring for some of these sites as well to see what their detections of Legionella might have been in some of these places. But this tool can be partnered up with other types of EPI tools to get a better sense of where risks might be or where points of exposure might be. And so there's another site that was set up by the European Center for Disease Control, and it's their Legionella disease GIS tool. And it's for Europe, but actually their map allows you to put points on a map all over the world. So this can be used by people outside of Europe as well. And you can put on here, if you have cases that have come up, you can plot them on here, and you can use their different models to identify sort of disease risk based on cases per population. You can add a buffer density to say within a certain distance from a source, what the buffer risk might be. So partnering up some of these tools where we know where things are to where we know where infections are occurring could be useful going forward. So I'm going to end there. I think that's probably on time for having a bit of time for questions and discussion, and I'll pass it back to you, Angela.